The FDA recently approved this campaign, which is graphic, and it does have pretty impressive pictures, which every cigarette pack will have to display prominently. There's been a lot of criticism because it does have a very impressive nature, basically sick patients related to smoking. So I would say anything that would discourage anybody from picking up the habit is helpful. So I do support that. I would consider this effective in two different levels. The one group of patients, the ones that are young adults considering maybe picking this habit, I think they will be impressed with the images, and if at least one chooses not to pick it up because of those images, I think it's a success. The second group of patients, the established long-time smokers, I'm not so sure how that's going to affect, because even in patients that have developed cancer themselves, tragically enough, frequently I see patients that cannot quit smoking even having developed one lung cancer already. So those that are already well established, I'm not sure how much of a difference that's going to make. Smoking is related at many levels, acutely in the short term and also in the long term. Obviously, the main worry is the development of cancers at different levels. Obviously, the lung is directly related to the smoking and the combustion of the cigarette. But at many different levels, it's been proven that cancer of different parts, including bladder and other organs, is clearly related to the over 4,000 chemicals that the cigarettes have. Smoking cessation has been studied up and down for decades, and basically one of the consensus that has been reached is that it has to be individualized. The patient that is interested in quitting smoking has to be the central part of this program, as opposed to trying to come up with a program that addresses the individuals in general. There's a couple of very interesting studies that have shown that the more tailored the treatment is to the patients, the more success they have. And so there's not one silver bullet kind of recommendation that I could give. I think the patients that are just considering the idea of quitting should really learn as much as they can about all the side effects and the consequences of smoking. I've had patients that still to date do not believe that smoking is related to the cancers and all the badness that we've been talking about. And I think if they just really got an informed and educated guidance as to what they're doing to themselves, I think that would motivate them to really pick up any of the programs. Going from cold turkey, which seems to be the most effective one once a patient is really that motivated, to medication assisted quitting in a progressive fashion. And we see that the patients that quit smoking over the long term, in some instances, do go back to baseline risks, both for lung cancer, for cardiovascular. And we're talking about decades and maybe even longer, but it definitely has long-term benefits. And on the acute setting, they will enjoy an easier breath. And basically, when it comes to getting me involved as a thoracic surgeon and doing any kind of operation, it doesn't matter how big or small it is, smoking plays a big role in the risk factors in the post-op recovery.